Welcome to Week 11 Oral Medicine Part 2. This week covers 5 conditions that dentists see in practice but regularly fail in exam conditions, not because they don't know the clinical features, but because they fall for very specific traps. By the end of this lecture, you will know exactly what those traps are and how to avoid every one. We are going through 5 topics today: herpes simplex, the primary and secondary, with the 72 hours Aciclovir rule, pemphigus vulgaris and mucous membrane pemphigoid, with the biopsy and immunofluorescence rules, trigeminal neuralgia and the 𝗘𝗏𝗫 scope creep trap, erythema multiforme, drug triggers and open disclosure, and finally 3 classic HIV oral lesions, antifungal choice in ARV context and HIV confidentiality. Every segment has a TG September 2025 rule attached to it. These rules are what the ADC tests. Knowing the clinical feature gets you halfway there. Knowing the TG rules gets you the marks. One point to remind you that the mock tests of this week have started midnight. Take the test under strict exam conditions. Evaluate your result. Study your weaker topics and domains. Then retake the test. It doesn't matter whether you have taken comprehensive course or crash course. Now, grand mock tests have the same level of difficulty. The upcoming 30 days intensive practice program will have only full mock tests for practicing with maximum benefit for your success in passing part 1. So take your test seriously, have a good study and take care of your health during your preparation.